Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about sepsis. And in this segment, we're talking with Jennifer LaMay. Jennifer is a nurse and the manager of quality, accreditation, and collaboration at McLaren Port Huron. Jennifer, welcome to Today's Health.
Thank you. I'm excited to be here.
Well, I'm excited to have you, and your title has kind of astounded me. It sounds like a lot of different things. So can you give us a little overview of your position?
Sure. As the manager for quality, accreditation, and collaboration, I oversee several different things in the quality management department. One of the first is accreditation. The healthcare industry is very highly regulated, so I make sure that we comply with all the standards we're supposed to, and these can come from CMS or the Joint Commission or other accrediting bodies, but through audits and rounding and education, I make sure we abide by those standards. The hospital participates in several programs called collaboratives, and in those collaboratives, we look at several service lines, and it can be general surgery, bariatric surgery, orthopedics, some cardiac procedures, and we collect data and we look at our outcomes and see how well we're doing and implement improvement processes to always give our patients the best care. And lastly, I'm the lead on the sepsis team. I collect data related to our sepsis care, and I help Dr. Brooks facilitate the Sepsis Excellence Team.
Well, as a member of our community who always benefits from great care, thank you for all that hard work.
You're welcome.
So why is there such a big focus now at McLaren Port Huron and nationally, Dr. Brooks was telling me, on preventing sepsis and improving outcomes?
Well, the big issue is the high mortality or death rate related to sepsis. It's a very serious condition, and there's been a lot of studies and a lot of research, and there are evidence-based protocols that if we implement them, we have much better outcomes. So we really want to get people in and get patients treated correctly, because then our mortality rate goes down, we don't have as many deaths, and the recovery is actually quicker and better for the patient.
Well, you said you're a part of the Sepsis Excellence Team.
Yes.
So can you tell me about that team?
That team, as Dr. Brooks said, is a multidisciplinary team. We have, people, nursing from all areas of the hospital, EC, ICU, med-surg, physician representation, IT and pharmacy are there to help us. And we all work together to see what we can do to make sure the sepsis patients are getting the best care. Every month we sit down, we have a team meeting, we look at the previous month's sepsis cases. Anything that has gone right or gone wrong, we look at and analyze. We look for barriers, we look at things that have gone well, and we all put our thinking caps on to see what we can do better to make sure that the patients get the best sepsis care that they possibly can.
On just a really practical level, you said we sit down every month and look at the sepsis cases. Mm-hmm. Are there sepsis cases every month? Is it that serious of an issue?
It is. We probably have anywhere from 90 to 100 people that may come in with some sort of sepsis. Most of the time it's a standard sepsis. It hasn't progressed into septic shock. But yes, that is a large volume of patients.
Wow, that's very sobering. Mm-hmm. What kind of activities have you been able to put in place as a result of the work of the team?
Oh, one of the things that I think helps us out the most is the sepsis screening. Every patient that comes into this hospital, you come into the EC, you get screened for sepsis. Right at triage, it's one of the first things that's done when you see the nurse. And that continues on if you become an inpatient. Multiple times a day, we're performing that sepsis screen to see if the signs and symptoms are there for sepsis. In addition to that, we've set up several order sets and protocols. The care for sepsis it's complex. There's a lot of things. You heard Dr. Brooks mention, it's antibiotics and it's fluids, and you got to look at lab results and blood pressure readings. So we really try to put things together so it makes it easy for physicians to order. They're thinking all the time. There's a lot to it. We like to give them the tools to make sure that they can order everything that needs to happen with that patient.
And I'm just thinking, as you're talking, you must have done a lot of education.
There was a lot of education. Recognizing sepsis is probably the most important thing, because you need to have the treatment as soon as possible. Better outcomes happen if you recognize it and treat it sooner. So there was a lot of education, not only in the EC, where most of our patients come in, but even on the floors, on recognizing sepsis.
Well, you're part of this team and you're doing a lot of measurement as part of your job. How successful has the team been?
Well, very. Extremely successful. Very proud of the work that we've done. I'd have to say, just as Dr. Brooks mentioned, that in the beginning, our sepsis numbers weren't that great. You know, our compliance with that, what they call the sepsis bundle, which is everything that we're supposed to do in the care of the patient, was actually low. You know, we've been working on a few years. We collect data every month, and CMS actually gives us comparison data, so we can compare ourselves to the state and the nation. And the last time they sent out those numbers, we were actually better than both the state and the nation average.
Oh, you must have a lot of pride in that.
We are, but you know, it's still lower than we want to be. There's still a lot of work to do. We really, you know, sepsis is important. It's important for our patients. You know, proper treatment is better outcomes, less deaths. So we still want to continue to improve as much as possible.
Well, both from listening to you and Dr. Brooks, I can tell there's a lot of energy on this team for really attacking this problem.
There is. We have a great team, and it's, you know, it's really multidisciplinary because sepsis affects everyone. You know, it can not only be the people on the floor, but you know, pharmacy needs to have our meds available, and we use our electronic medical record in order to give us prompts so that we're doing the right thing. So having all these people come together and come up with different ideas, thinking outside of the box, it's really something to be excited about.
It is very exciting. Do you have closing comments?
Yes, I do. What I'd like to say is the thing about sepsis is it needs prompt treatment. So anyone that watching this today, you know, Google some information, talk to your physician about the signs of sepsis so that you can come in and be treated promptly, and never be afraid to say, I'm concerned about sepsis.
Thank you so much for joining us, Jennifer.
Thank you.
And thank you for joining us. We've given you a lot of information, and it's really important information to kind of take in and understand, so you know you can always call us at Health Access. And that's 1-800-228-1484. You can go on our website, and that's mclaren.org/PH contact. You know, you can always go to our website to get a copy of this program or for great reliable health information, and that's mclaren.org/PHTH. As always, we hope you watch Today's Health again next week. Today's Health is brought to you by McLaren Port Huron, doing what's best.